Hello, healthy moms. It's a crazy day. I'm having some technical issues here. I don't know why the live is not broadcasting on our Inyango page, and most of our viewers are on our Inyango page. So I'm just going to be trying from time to time, and I hope you get to watch it from somewhere. But either ways, we are live on YouTube, the Inyango page on YouTube, and Facebook. So I'll just try to make some people aware about that. And then we move on to our topic of the day. It's a crazy day, but it doesn't mean the day has to make us crazy. So we move on to what we have to do. And we talk about the topic we have to talk about, and we learn and we move on. So, as I said earlier, today we are going to be talking about preterm birth. And I'm going to be giving you as much information as I can to help you understand it more, such that in case you see someone with it, or in case it happens to someone close to you, you can be of help to them in a certain way. And you won't just be blank, and you would know how to prevent it, because with some of these things, if you can prevent it, then it won't happen to you, and you won't get to the stage which you have to maybe suffer from it. As they say, prevention is far better than cure. So stick with me, please, and give me a few minutes. Let me just share this on, because we have a lot of followers on our Inyango page, and I just have to get them here. And then we are going to go on with our we'll go on with our with our live session for today. Okay, so today we are going to be talking about preterm birth. Please, if you're around, just leave a comment so that I can acknowledge your presence before we start. So if you're around, please leave a comment, leave a like, leave something, share this video, because in as much as mothers don't talk about it, there are lots of mothers who give birth to premature babies. It is actually preventable. Wow, yay! We finally succeeded to get it on the Inyango Facebook page. Thank God. I was already getting worried, because if it is not broadcasted there, then after all the long video, I will have to go back to maybe share it there. But I'm happy that it is actually broadcasting there right now. Thank you for your patience, and we just go on to our topic of the day. Before we start, I would like to hear a little of your story. Do you know anyone who has given birth to a premature baby before, who has given birth preterm? Just let me know a little bit of your own story. I actually had a friend who gave birth to a set of twin babies prematurely. And when she said it, I just brushed it away. You know how us Africans do these things. When you hear about something which you don't wish for yourself, you just brush it away and you fail to learn about it. But from learning about it right now, I realized that there are a lot of things that we need to know that can help us prevent it, because the causes are not really things that we can prevent, but there is always something we can do, right? There's always something you can do as a mother. There is always something you can do as a person to reduce the chances of some things happening to you. And today we are going to talk about preterm birth, because it is important that we know about it. By us shifting away topics which we have to learn about, it doesn't help us prevent it, but instead puts us at a higher risk of suffering from it. So that's it. I'm going to be getting into the topic in a few minutes, and I don't want to be here for so long. So please stick with me, learn as much as you can learn, and just just jot your questions down and everything, so that you pick up something from today. So as I said before, please, if you're with us, do leave a comment so I can acknowledge your presence. If you're watching from my personal Facebook account, I'm sorry I cannot see your comments. But if you're watching from the Nyango Facebook account, yes, I can see your comments. So we move now right into the topic. And I would really like to welcome you. I see 2 views, but I don't know who that is. I just want to say welcome and say thank you for joining us. So please leave a comment and don't forget to share the video. All right, there might be somebody who's looking for this information and you might just be saving a life. So what is preterm birth actually? I usually like using the word premature because that is the word which we are used to around here. Like when we hear premature, it's easy for us to like know, okay, it's a baby who is born before time or something like that. But the actual definition for preterm birth is babies born either 3 weeks before the normal time which they're supposed to be born or precisely before 37 weeks. So now normal babies are usually born around 40 to 42 weeks. Like if a baby is born at 38 weeks, it's okay. 39 weeks is okay. 40 weeks is very much okay. 41, 42 weeks, very okay. But if a baby is born below 37 weeks, they are considered preterm babies and they are called preemies. So if you hear me use the word preemies, just understand I'm referring to premature babies or preterm birth babies. So now there are some common symptoms. I'm going to be talking and getting into it like this. So I've done the definition already. I'm going to be talking about some of the common symptoms in the mother and in the baby. I'm going to be talking about some causes. I'm going to be talking about possible treatments. And then I'm going to be talking about ways in which you can prevent yourself from having a preterm birth. So that is how we are going to be talking about this topic. So stick with me. And again, if you're around, leave a comment, share the video. It's very important because some mother somewhere, someone somewhere might just be looking for this information. So let's go on to some of the possible symptoms in the mother. Now, for the mother, some symptoms might include more than 4 contractions in an hour within the 30th trimester of your pregnancy. Also, pressure in the pelvis, like you start feeling your pelvis is very heavy. The pelvis is that under, like the lower point of your abdomen, the lower point of your stomach, that really low point. You start feeling some really heavy pressure, like the baby is almost coming out. That's when you start feeling that pressure. Also, vaginal bleeding in the 3rd trimester, watery discharge, which might be as a result of rupture of the membranes, which the baby is supposed to be inside. Those are some possible complications or symptoms that might happen in the mother. Also, heavy back pain and lower waist pain could be a symptom to show that you're about giving birth to your baby preterm. Now, excuse me, when the baby is born preterm, some of the symptoms which the doctor would see in the baby to realize this baby is actually born preterm is immature lungs. Also, the babies will have low body fat. The babies will have difficulties breathing, also difficulties regulating temperature. Also, poor feeding. They might not have as much composure as a normal baby. Though, yes, a baby who is born full term would normally still be shaky and all, and the neck will still not be balanced. But a baby who is born preterm, they are usually really weak and mostly very tired. And if you happen to feed them, you might realize that in just a few minutes, they just get tired and they turn their heads off the breast because it takes a lot of energy. Since their sucking reflex and their swallowing reflex has not developed fully, it takes a lot of energy for them to actually suck and get food, which also leads to low weight for preterm babies. So those are some of the symptoms which are going to be seen. And I would like to give you like an allocation of how preterm babies are classified. Now, for babies born between 28 to less than 32 weeks, for babies born less than 28 weeks, this is the first category. They are extremely preterm. For babies born between 28 weeks to 32 weeks to less than 32 weeks, they are considered very preterm. For babies born between 32 weeks to less than 37 weeks, they are considered moderate to late preterm. And babies born from 34 weeks to 37 weeks are considered late preterm babies. But we have to understand that no matter how late preterm a baby is, any baby who is born before 37 weeks is considered a preterm baby. So they are very delicate and they need a lot of care. Now, I'm going to go on to give you, if you didn't watch our video on the science of pregnancy simplified, I think that was the topic I used. I cannot really remember the topic very well, but in this particular video, wow. In this particular video, I explained detailedly what happens in a mother's tummy from the first week of birth till the 40th week or 42 weeks when you give birth. So if you've not watched that video, please go search on our page and you'll see a video like that and watch it, because it'll give you a lot of information on why preterm babies are so delicate, because it is in those last weeks of birth that organs like the brain and the lungs are fully developing, and the baby is also gaining weight to actually help them survive outside the world. So it is usually said that babies who are born at 22 weeks have a 6% chance of survival. Babies who are born at 23 weeks have a 26% chance of survival. That, as in, they have a 26% chance of surviving out of the womb, because they are actually supposed to be in the womb at this time. Babies who are born at 24 weeks have a 52% chance of surviving outside the womb, and babies who are born around 25 weeks have about 72% chance of living. Now, we have to understand that the earlier the baby is born, the higher the risk of complications that the baby will have. Premature babies usually have a lot of complications. So when a baby is born preterm, it's usually called seen as an emergency, and doctors have to attend to that baby immediately. Yes, when a mother gives birth to a preterm baby, most times they feel so stressed and they feel like they just want to hold their babies and all. We all want to hold our babies immediately. Like, till date, I'm still angry about the fact that I couldn't skin to skin contact with my babies from when I gave birth to them, because I gave birth through CS. Though yes, in the more developed world, no matter how a mother gives birth, they usually give the mother the baby like immediately the baby is born, and they give you the opportunity to have that skin to skin touch. But in my case, I didn't have it until today. I feel like, oh, I missed something. So it could be really, really stressing for you not to be able to have that contact with your baby, that first contact with your baby. Like, it's just wonderful. So I'm going to give you right now some courses of preterm birth, or some things which can put you at higher risk of preterm birth. Now, there are some of them which are adjustable, like you can modify them. There are certain things that you can do to prevent them, but there are some of them which you cannot prevent them. And normally, the main causes of preterm birth and have not yet been discovered. So there are times which a mother can give birth to a baby prematurely without you even being the cause. Okay, so if you have given birth to your baby prematurely, it is at times it is not your fault, and you don't have to blame yourself for it. At times there's just nothing you can do, but these are some causes and some things which might put you at higher risk of giving birth prematurely. These two people whom I see watching me, and they're not saying anything, this is supposed to be a very interactive session, and I really need you to say something. Just say something. I see your likes coming up, but I don't see anything that you're saying. Or maybe you're watching me from my personal account, that's why I can't see your comments, but it's definitely okay. I thank you so much for being here and for watching. And again, please do not forget to share. Okay? Please, a minute. I'm always doing this and doing so many things. Oh, thank you, Lady Jackie. She's always here. You're just so much of a darling. Like, having a sister like you, it's just something so wonderful. Okay, now I'm going to go on. Oh, really? I thought as much, because I was seeing people watching and I'm not seeing comments, and probably you're leaving your comments there and I will not be able to see it. And even when I finish with this live, I hardly have the time to go back and watch. And with live sessions, you don't just go and then see comments on that. You have to watch till the particular time which the person sent the comment before you can see the comments. So it's just a lot of work most times. Please remember to share the video. Okay, I was on some of the causes or things which might put a woman at higher risk of having preterm babies. Now, some of the causes might include medical conditions, like maybe your pregnancy history. If you've had a preterm baby before, maybe in your first pregnancy, there is a higher chance of you having a preterm baby again in future, right? So those are just some things that might increase your risk. So if you've had a preterm delivery before, you have to be extra careful not to have another one, because your chances of having another one are even higher. And another thing is multiple birth. If you're having twins or triplets or just more than one baby, you stand a higher chance of having babies who are premature. Like the friend I have who had preterm babies was actually pregnant with twins. Like they're the first twins that I actually had so much contact with. Like I used to help her take care of her twins. And most times I'll tell the babies, tell your friends to come to me, okay? I want twin babies like you. And the girls were just so beautiful. But like many premature babies, their development milestones are not like that of normal babies. Like, and this relates to so much the weight of the baby at birth. Most times mothers just push it away. They usually just easily forget the weight of their babies at birth, of which that is a very high indicator of how your baby is going to grow and how your baby is going to get to maybe their developmental milestones and how early they get there. So another cause is multiple pregnancies. Also assisted reproductive technologies, like people who are giving birth through the IVF. This is when they get maybe the egg from the woman, and then they get the sperm from the man, and then they fertilize it before putting it into the woman. Those kind of cases are more likely to lead to multiple birth. So it has a higher chance of leading to preterm birth in general. Also, uterine or cervical abnormalities like short cervix. Normally, when you're pregnant, your cervix keeps getting soft, right? So since it is short, it might get soft and reach the level which the baby has to be born faster than somebody who has a long, tight cervix. Also, infections are something that can actually make you to give birth really fast. Infections, malaria, all those kind of complications, medical complications that might come, things like urinary tract infections, bacterial vaginosis. These are other things that when you go to the hospital, if you're taking your antenatal care seriously and they find these things, they'll handle it before it gets to the point where it has to lead you to maybe having a preterm birth. Also having diseases like diabetes, high blood pressure, pregnancy complications like gestational diabetes and preeclampsia are some of the highest causes of preterm birth. Also genetic influence, like if your mom usually gave birth to her babies preterm, you have a higher chance as well if you took her genes of giving birth to your own babies preterm. Now, some modifiable factors. So before I go to the modifiable factors, I would like to talk about some more causes. Okay, some other causes are being pregnant 6 months after a previous pregnancy. So it is not really advisable when doctors will tell you to stay a long time before having your second baby, maybe a year plus before getting pregnant again. They have their reasons, because after giving birth, your uterus, which is your womb, needs time to heal. And if another baby starts growing there, it has a higher chance of you giving birth preterm, right? Okay, that's another cause. Also, having multiple miscarriages or multiple abortions might also lead to a chance of you having preterm birth, right? Because if you're having multiple miscarriages, it might be because your womb is not strong enough to carry a baby. So normally, if it actually succeeds to carry a baby, it might make it in a way that before the baby reaches full term, the womb might maybe rupture or other serious conditions, and you might just have to give birth preterm. But those are some causes. Also, problems with the womb, like I talked about, rupture of the membranes, problems with the placenta, and with the cervix, like I talked about, short cervix, could also lead to preterm birth. Now, there are some things that are modifiable. There are some things that cause preterm birth that are actually modifiable. Such include like your lifestyle patterns, like having an unbalanced diet before or during pregnancy might lead you to having a preterm baby or a baby who is born with very low weight. Most times, premature babies are associated with low birth weight, right? Like all the time, premature babies mostly have low birth weight. And when a baby has low birth weight, there are just so many complications that might come out of it. Like I said before when I was giving the symptoms. So the modifiable lifestyle unbalanced diet. So if you're eating an unbalanced diet, try to eat balanced diet. Also being overweight or underweight before pregnancy, and also being overweight or underweight during pregnancy might lead to you having a preterm baby. Also taking illicit substances like drugs, alcohol, and smoking might also lead you to having preterm birth. Also, any kind of trauma, maybe an accident, the loss of a loved one, or maybe just high levels of stress. There is a video that I have on our page, which it's very short. It was not a live video, so that one is really short, on how to manage stress during pregnancy. If you've not watched that video, go and try to watch it if you're pregnant, because it's going to actually help you so much. Because high levels of stress can also lead to preterm birth. Now, another thing which is modifiable is healthcare. If you don't go for your antenatals as early as possible, it might lead you to having a preterm baby, because there might be some complications which would have been discovered early, which, because you didn't go for your antenatals, could lead to preterm birth. Now, sleep deprivations could lead to high levels of stress, which could actually lead to preterm birth. But sleep deprivation on its own cannot really lead to preterm birth, because it is when you become a mother that you realize that you can actually live with 1 hour of sleep. Yeah, you realize that you don't sleep, but still you can function. So sleep deprivation, through leading to high levels of stress, because when you're not sleeping at a certain level, you become really stressed. Little things just get to you. On its own, it cannot cause preterm birth, but with leading to high levels of stress, and then that can cause preterm birth. So if you're pregnant, you should try to sleep well. It's hard. Like during the third trimester, getting enough sleep is so hard. Like your tummy is just big, and getting the right position is just like hell. I remember that we had to change our foam on the bed about 3 times before I could get the right one. Like having a very slim tummy before, and then my tummy looking like 3 times or 4 times, or even 5 times my normal tummy, made it so difficult. So sleep deprivation can actually lead to a lot of stress, which could lead to preterm birth. So if you're pregnant, try as much as possible to sleep well. Because after you give birth, you might not have the time to sleep, because the baby will be getting up at night and will be crying. So you just have to try to sleep enough, okay? So I'm on now to possible treatments. I've talked about the definition, I've talked about the symptoms, I've talked about symptoms for the mother and for the baby, I've talked about the causes, and now I'm going to be moving on to the treatment. Now, when you give birth to a baby prematurely, like I said before, it could be really stressing for the mother, because you want to give birth to your baby and hold your baby and breastfeed your baby and have some time with your baby. And then you give birth to a premature baby and they have to put the baby. The first thing that they mostly do is to put the baby in the incubator. This particular set of things done are called supportive treatments, to support the baby to actually gain the right weight, to be able to do things like a normal baby, support the baby's lungs to grow well and the brain to grow well. Yes, so the first thing that they'll do is to put your baby in an incubator. Also, they would take blood samples to check the baby and make sure that things are going on well inside the baby. Also, they'll also monitor vital organs. Also, they might put a feeding tube on your baby. So they might insert the tube through the nose, through the mouth, or through an incision on the stomach. Like, I know it could sound crazy just listening to it, but if we know these things, if it happens, we can best manage our emotions and best manage the condition, because we had an idea of what is going to be done. It is not something which you wish for any mother, but sometimes things happen, and this is life. We have to prepare for certain things even before they happen, so that we can know how to manage certain situations. Also, in certain cases, the baby might need blood transfusions, because they might have to take blood samples from the baby from time to time to test certain things to make sure that the baby is okay. So with those continuous samples that they're removing, the baby might have a certain level of anemia, which is shortage of blood, and they might need to do blood transfusions. I would also like to let you know that these feeding tubes, which might be inserted through the nose, through the mouth, or through an incision in the stomach to connect directly to the stomach, might be done if the baby's sucking reflex are really weak. Because with a premature baby, since their weight is usually very low and their organs are not fully developed, they need a lot more nutrients than a normal baby. And their organs are not yet developed, so their organs might not be able to process the milk that they get to actually produce the nutrients that they get to help them gain the weight and then develop their organs. So that is why at times they might just send a tube through the nose, nasogastric tube through the nose, so that the food gets directly to the stomach and the stomach can start processing it, though it might take a longer time than a normal baby. So these tubes will be put in only if the baby's sucking reflex are not yet developed to the level that the baby can actually take in enough food. So there are cases which you might give birth to your premature baby and then these tubes are not put in, and you might have to feed the baby with the bottle or through extracting breast milk, or other things. Like if your own breast milk is not yet out, it has not yet started coming out, they might get breast milk from a donor, like another mother who maybe has lost a baby, or a mother who has given birth to her baby but she's producing excess milk. Or you might introduce formula, but all they want is that the baby should get enough nutrients, because that is what is going to help your baby to survive. Also, it is very important for us to know that about 15 million babies die globally from preterm birth. So if you can prevent it, do all you can to prevent your baby from being born premature, because no baby deserves that kind of suffering. Also, in some cases which the baby has a lot of complications, surgeries might be needed. Yeah, but this is in extreme cases where the baby has a lot of complications, and the doctors will tell you what kind of surgeries your baby will need and explain it to you very well. So that is it about treatments. Let me see if I have anything more about treatments. Yes, I've talked about the child being put in the incubator. At times also there might be oxygen therapy where the baby is given oxygen. Also, they might have to put them infusions to maybe send the nutrients and water and everything directly to the veins and to the blood, so that the baby can gain the weight and the organs can get developed as fast as possible, because the baby needs to develop on time. And also another thing which has been tested to prove that another thing which has a higher chance of helping premature babies is kangaroo care. This is when the mother has a skin-to-skin contact, like the mother being naked with her body and the baby is actually naked and the baby lies on the mother's body. I don't know why I didn't bring baby Laya Lisa. Those are the names which you ladies gave for her, Lila and Lisa. So I'm calling her the two names. I forgot to bring her. She's sleeping somewhere, so I couldn't wake her up. But you put your baby on your chest and then they wrap the mother with a very thick cloth so it keeps the baby warm enough. It is also one particular thing which helps so much. It is said to help babies gain more weight and just recover faster. Yes, so those are some few things about treatment. Yeah. So the reason why the babies are put into the incubator is to help regulate their temperature, because premature babies usually have difficulty regulating their temperature. 1 minute their temperature will be very high and the other minute it's very low. Excuse me. So they are put in the incubator so that it can regulate their temperature and their humidity. Now I'm going to go on to tell you how you can prevent having preterm birth. Yeah, Lady Jackie is actually really delicate. It is really, really delicate. Yeah, baby L. Baby L is sleeping, so I couldn't bring her here. I didn't think I would need to demonstrate anything. That's why I didn't bring her. But from today, I'm going to bring her to every live session because it might just be something to demonstrate. And if she's not here, then I can't demonstrate. So from today, I'm going to bring her to every live session. So now, how can you prevent preterm birth? It is preventable. From the causes, you actually know that it is preventable. Now, for number one, you can take multivitamins and folic acids. Like I keep hitting on this folic acid thing. I think I've made a video on why you should take folic acid or why you should take your multivitamins and all. Yes, I made a video on the importance of folic acid. So if you've not yet watched that video and you're still thinking, oh, why are they giving me this many drugs? I'm not sick, I'm just pregnant. Go and watch that video. It will boost you to take those things. So taking your folic acids can actually help you prevent preterm birth. So take your multivitamins and your folic acids. Also, wait until at least 18 months, before getting the next pregnancy. We know things happen, but as women, we can actually prevent certain things. That is why don't wait till your period comes before you say, okay, I can get pregnant. You can actually get pregnant without your period coming. So try to just take preventive measures when you're doing things with your partner, because if you're married, there is not so much that you can do, but you guys can do coitus interruptus, which is the barrier method. This particular one remained in my head. If you've not watched our video on family planning, go ahead, check our playlist or whatever I'll call it, and you're going to see our video on family planning and watch it. You understand what coitus interruptus is if you don't know what it is. But if you're someone who has been following us continuously, you would know exactly what coitus interruptus is. So let's go on. So I said wait until 18 months before the next pregnancy so you can put in a family planning method immediately after birth, or just try coitus interruptus. It is the barrier method, like the method where the husband pulls out and sends everything outside instead of leaving it inside of you. Stop asking me what with many question marks. That is it. Okay, the other thing you can do is go for antenatals early. I remember I went for antenatals at three months, if I'm not mistaken, 2 months something or 3 months. It is not good. Like I wasn't aware. I was very ignorant. That's why. If when you realize that you're pregnant, just start your antenatals. Start as early as possible. It helps prevent a lot of things. If you realize that you're 2 weeks pregnant, start antenatals immediately. Don't wait till maybe your stomach starts showing. No, no, no. Hey, Jackie, I'm not the one who will tell you everything here. I will not tell you everything. Don't make Facebook to come and block our page. I cannot tell you everything here. Go online and look for coitus interruptus. Stop asking me questions. Okay, another thing you can do is to keep to your doctor's appointments, even when you're feeling fine. No matter how you're feeling, just keep to your doctor's appointments and be there always and on time. Let them do all your checkups because it helps so much with preventing preterm birth and other pregnancy complications. Also, stay active, eat healthy, maintain a balanced diet, and make sure you're within your healthy weight. Because as we say, a healthy mom will normally have a healthy baby and in line have a healthy home. So we want to stay active and stay healthy and do everything that we can do to keep ourselves healthy. Workout, if you don't know what to do as a pregnant lady, we have a workout for pregnant women on the Nyango WhatsApp group. And if you wish to join, just leave a comment here and I'm going to write you privately or write me privately on any of my social media handles. Larissa Livella is what I am on all social media handles. In fact, just Google Larissa Livella and you'll see all the social media handles appear there. So those are some things you can do to prevent yourself from having preterm birth. Also, avoid tobacco, avoid these illicit substances like drugs and all the other things. Keep yourself safe, reduce your stress levels, and just stay safe, be healthy, okay? Because we want to have healthy babies. When you have healthy babies without complications, it makes life really easy for you because you give birth to your baby and in 1 or 2 days, you've gone home. And you go, and though you'll be struggling with the sleepless nights, it's not like having to maybe come to the hospital to come and see your baby in an incubator. It's so delicate. And for most babies, They need a lot of nutrients and a lot of care that you don't even know when you're taking your baby home. And you're just in the hospital always on your toes. And I don't want any mother to be in that particular situation. But if you are in that particular situation, know that everything is going to be all right. Just listen to your doctors. If they're giving your baby so much milk, don't think that they're just trying to suffocate your baby. Your baby actually needs it. For everything which they are giving your baby needs it. I just have to believe in them and actually work with them so that they can help your baby. At times, babies born prematurely pass, but if that baby actually passes, it only means that even the baby stayed longer, the baby won't have been as healthy as a normal baby would be. And we have to understand that if you gave birth to your baby with very low weight, or you gave birth to your baby prematurely, don't expect your baby to start creeping or eating solids like other normal babies, right? If you're trying to calculate when to start giving your baby solids as a premature baby, don't count from maybe you gave birth to your baby at 36 weeks. Don't start counting from there. And then you expect that from 36 weeks, I gave birth to your baby from the birth date, and 6 months, you have to start solids. No. Subtract the number of weeks. So if you gave birth to your baby at 36 weeks, I really need to explain this. If you gave birth to your baby at 36 weeks, that is, your baby is preterm, and you are wondering when to start giving solids to your baby, you have to, if your baby is 6 months, right, subtract 4 weeks from that 6 months, which means your baby is actually 5 weeks. It's actually 5 months rather. Your baby is not 6 months because you gave birth to your baby at 36 weeks, and a normal baby is supposed to be full term at 40 weeks. So you have to subtract 4 weeks from that 6 months to give the actual age of your baby before you can know when to start giving your baby solids. And some things which you should see to know that your baby is ready for solids is when your baby can actually sit up very well with support of some things. Your baby can actually swallow. Your baby is not very mobile, like you put your baby to sit and your baby can actually sit properly, not the one that your baby is very weak and all, and your baby cannot even take breast milk enough, and then you want to introduce solids. Though you might want your baby to gain weight, or with a preterm baby, a preemie, you have to be very, very careful and treat them very delicately. But again, I would like to remind you that people like Sir Isaac Newton, with the greatest physics inventions, was a preemie. So if you have a preemie, it doesn't make your baby any less special. So with that, I come to the end of this session. Thank you so much, Lady Jackie, for joining. And our ghost viewer, I'm sorry for calling you a ghost viewer, but you've not said anything since we started. And I really wanted to hear from you. So it's going to be goodbye from me. To have a beautiful evening. If you have any questions, I'll just give 2 minutes for you to drop it because I want to stop this live session at 40 minutes exactly. So if you have any questions, please do not hesitate to send them so I can answer your questions. I would have loved to answer some very frequently asked questions, but I might do that on another day because we are already against time, or I might do it on a post or on a short video. But either ways, thank you so much for joining. If you have a question, please do not forget to leave it in the comment section. Thank you so much, Lady Jackie. So any questions for me? Any questions for me? We have 2 minutes. The time is ticking. 2 minutes to go. 2 minutes to go. If you made time for this, then that is great. Because knowledge is very, very important. It is very, very important. It's very, very important. We have to keep updating our knowledge as much as we can, because knowledge is one thing that is going to help you go through a lot of situations very calmly. I still remember a certain day that we're coming home and I saw a very steep hill, and I had to ask our driver, are we going to pass through this hill? And he said no, because the knowledge of me knowing that we could pass through that hill already gives me a certain confidence, like I prepare my mind for it. So knowledge just helps you. So I guess there are no questions. Thank you so much for watching, and stay blessed. Do have a beautiful evening. See you next week, I hope, by the grace of God, and stay blessed. Love you. Bye-bye.